All right, welcome to week 4. This PowerPoint is in 2 sections. First, we'll go over the female reproductive system, and then we'll go over the male reproductive system. So we are going to jump into anat and phys of the female reproductive system. So the ovaries are the main female reproductive gland. They have 2 main jobs, which is release eggs called ovulation, produce hormones, which would be estrogen and progesterone. Each ovary contains small structures called follicles, which hold an egg or ova. After puberty each month, several follicles start to grow. Usually one becomes the dominant follicle. That follicle releases a mature egg during ovulation. The uterus is a secondary sex organ. It is a pear-shaped organ located in the pelvis. Its main function is to support and nourish a developing baby during pregnancy. Parts of the uterus include the fundus, which is the top portion, the body, which is the middle, and the cervix, which is the lower portion that connects to the vagina. Layers of the uterus involve the endometrium, which is the inner lining where implantation occurs, the myometrium, which is the middle muscle layer and helps with contractions, and the outer layer, which is the serosa or peritoneum, and that's the outer covering of the uterus. The opening of the uterus, we have 2 terms, the internal os, which is the opening into the cervix, and the external os, opening from the cervix into the vagina. The fallopian tubes extend from the upper sides of the uterus and end near the ovaries. Its main function is to carry the egg from the ovary to the uterus, usual site where fertilization happens. If fertilization occurs, the fertilized egg travels through the tube, what then implants into the uterine lining, which is the endometrium. Breasts are also a secondary sex organ. The structures change with age. In younger women, mostly they have dense glandular tissue, and with age, the glandular tissue decreases and is replaced by fat. This natural process is called involution. Why this matters in imaging, fat shows up more clearly on imaging and it makes it easier to see abnormalities. Breast function produces milk after pregnancy, which is lactation, and during pregnancy, hormones like estrogen and progesterone prepare the breast for milk production. Breast pain is called mastalgia, usually caused by normal tissue changes, not cancer. We're going to talk about a hysterosalpingiography, or HSG. So an HSG is a common radiographic exam used to evaluate the female reproductive system. What it evaluates is the cervical canal, uterine cavity, fallopian tube, spillage into the peritoneal cavity. How it works is contrast dye is injected into the uterus and fluoroscopy is used to watch the flow of the contrast. It's done because it is most commonly used to check infertility. It must be performed on a non-pregnant patient. The key finding would be blocked or non-patent fallopian tubes that may cause infertility, and free spill of contrast into the abdomen means the tubes are open or patent. An external HSG is mainly diagnostic. It can sometimes help improve tube openness by gently opening or stretching the tubes. A mammography is an X-ray exam of the breasts. Uses are breast cancer screening. It evaluates breast problems such as breast lumps and masses, breast pain, nipple discharge, skin or lymph node abnormalities. Screening guidelines from the American Cancer Society: ages between 40 and 44 may choose to begin yearly mammograms. At age 55 or older, they may switch to every 2 years if healthy. A digital breast tomosynthesis, or DBT, is called a 3D mammography. The advantages are it produces multiple breast images from different angles. It reduces problems caused by overlapping breast tissue and helps detect masses more clearly. The benefits are better lesion detection, improved localization of abnormalities, and more accurate breast imaging. Sonography, or ultrasound, is the primary imaging method for the female reproductive system in both pregnant patients and non-pregnant patients. It is very accurate and uses no ionizing radiation, it is also safe for mother and fetus, which is why it is used. Types of pelvic ultrasound, there's a transabdominal ultrasound where the probe is placed on the abdomen. It requires a full bladder. Full bladder acts as an acoustic window to help see the pelvic organs. And a transvaginal ultrasound, the probe is inserted into the vagina and provides better images of uterus, ovaries, and pelvic structures. The uses of ultrasound in non-pregnant females, ultrasound helps evaluate ovarian masses, uterine masses, and pelvic pain. The ultrasound can show the size of a mass, the location, internal characteristics, and effects on nearby organs. The uses of ultrasound in pregnancy. Ultrasound is the imaging method of choice for placenta location, multiple pregnancies, ectopic pregnancy, gestational age, fetal abnormalities. Ultrasound and breast imaging. Ultrasound is also used to evaluate breast masses. It can help determine if a mass is cystic or fluid-filled, or if it is solid. One important note that ultrasound is not the main screening test for breast cancer. Jump to MRI. So what is MRI used for in female reproductive system? It provides detailed images of the pelvic organs, uterine masses, ovarian masses. Ovarian cancer, MRI is very useful for detecting ovarian cancer, determining if cancer has spread to nearby pelvic structures, and cancer staging. Breast MRI is also used to differentiate between benign and malignant breast lesions and screen high-risk patients. High-risk patients include a patient that has a strong family history of breast cancer and positive BRCA gene mutation. Advantages of MRI is excellent soft tissue detail, no ionizing radiation, helpful for cancer staging and lesion evaluation. Congenital uterine abnormalities. So these abnormalities occur when the reproductive structures do not form normally before birth. Bicornuate uterus is most common a uterine abnormality. The uterus has two upper horns. They are heart-shaped appearance. It may cause infertility or pregnancy complications. A unicornuate uterus is a smaller uterus with only one fallopian tube, and a kidney on the same side may also be absent, and it can affect fertility and pregnancy as well. Uterus didelphys is a rare condition. It's a double uterus, cervix, and sometimes vagina, may lead to reproductive complications. PID is pelvic inflammatory disease. It is a bacterial infection of the upper female reproductive system. Organs that are commonly affected are the uterus, fallopian tubes, and ovaries. Common causes of PID is often caused by gonorrhea, chlamydia, and other bacterial infections. Risk factors include sexually transmitted infections, or STIs, untreated infections, and unsterile procedures. Symptoms, common signs and symptoms include pelvic pain, fever and chills, nausea and vomiting, vaginal or cervical discharge, pelvic tenderness. Complications without treatment, PID can cause scarring of fallopian tubes, infertility, ectopic pregnancy, spread of infection into the abdomen, and septic shock if severe. Imaging evaluation, so common imaging methods would be a transvaginal ultrasound or MRI. Imaging findings may show thickened fallopian tubes, fluid-filled tubes, abscess formation. The main treatment would be antibiotics. In severe cases, it may cause surgery or a drainage of the abscesses. Ovarian cysts are common and usually benign, often found in women of reproductive age. They can cause pelvic pain or pressure, and sudden sharp pain may mean rupture. Imaging, so an ultrasound is primary imaging. The follicular and corpus luteum cysts are related to the menstrual cycle. Endometriosis, so an endometrial tissue grows outside the uterus. Causes are pelvic pain, painful periods, and infertility. Imaging would be a transvaginal ultrasound, and sometimes MRI is used. Endometriosis is strongly associated with infertility. Dermoid cysts or cystic teratomas are commonly benign ovarian tumors. They can contain hair, teeth, and fat. Imaging involves ultrasound, CT, or MRI. Dermoid cysts may contain teeth or hair, like I said up above. Ultrasound is the first imaging for ovarian pathology. Endometriosis causes infertility. Ovarian cysts are usually benign. Dermoid cysts may contain teeth or hair. Sudden sharp pain may indicate cyst rupture. What is an ovarian torsion? An ovarian torsion occurs when the ovary twists on itself, so blood flow to the ovary is reduced or blocked. Why is this important? Ovarian torsion is a medical emergency. Without blood flow, the ovary can become ischemic and tissue can die. Most important symptoms include sudden severe pelvic pain, usually one-sided pain, and the patient would have nausea and vomiting. Imaging would be a Doppler ultrasound, which checks blood flow to the ovary. Important findings would be reduced or absent blood flow which would suggest torsion. Ovarian cysts may increase risk as well. Causes and risk factors, ovarian cysts or masses can increase risk, and enlarged ovary may twist more easily. And then I just have some must-knows at the bottom there for you that you can review in the notes. Ovarian cancer is a malignant tumor of the ovary. Important facts are it is the most lethal gynecologic cancer, often found late because symptoms are vague or absent early. Risk factors would be a family history of cancer, BRCA1 or BRCA2 gene, older age, and late menopause. Symptoms are often vague and may include bloating, pelvic or abdominal pain, back pain, weight loss, change in bowel habits, and pressure on the bladder or rectum. Many patients have no symptoms early on. Diagnosis and imaging would be a lab test, which is the CA-125 blood test. Imaging would be with ultrasound, CT, or MRI. The imaging purposes are to detect masses and evaluate spread of cancer staging. Common treatment includes surgery, a hysterectomy, removal of ovaries and fallopian tubes. Chemotherapy and radiation therapy is less common. And then there are some need to knows, which I have already talked about up above. What is cervical cancer? Cervical carcinoma is a malignant or cancerous growth of cells in the cervix, one of the most common female reproductive cancers. The cervix is the lower part of the uterus. Cause and risk factors. So the most important cause is HPV. Other risk factors are multiple sexual partners, prior STIs, smoking, and a weak immune system. Most common symptoms would be abnormal vaginal bleeding, especially bleeding after intercourse. Diagnosis, the main screening test would be a pap smear, and a confirmation would be a biopsy. Imaging, if cancer spreads or becomes invasive, we would be using CT, MRI, chest imaging, and skeletal imaging. MRI is excellent for staging cervical cancer. Treatment depends on stage and severity, so common treatments would be surgery, radiation therapy, and chemotherapy. And then at the bottom in the notes, you can also see some must-knows. Alright, so leiomyoma is also called the uterine fibroids. They are benign, solid tumors of the uterus and made from smooth and muscle tissue. They are the most common benign tumor of the female reproductive system. Symptoms include many fibroids cause no symptoms. More severe cases cause enlarged uterus, heavy menstrual bleeding, pelvic pressure, low back pain, pressure on bladder or bowel, pain, anemia from heavy bleeding. Important characteristics involve growth. The growth is influenced by estrogen and may enlarge during pregnancy. Usually it shrinks after menopause. Fibroids may contain calcifications and they are visible on imaging. So common imaging methods would be ultrasound, HSG, CT, and MRI. The primary imaging would be ultrasound though. And then I have some must-knows in the notes. Adenocarcinoma of the endometrium or endometrial cancer. This is an adenocarcinoma of the endometrium and is the most common cancer of the uterus. It is a cancer of the uterine lining or the endometrium. It's most common in postmenopausal women as well. Risk factors involve obesity, late menopause, never having children, tamoxifen use, diabetes, family history of breast or ovarian cancer, and previous pelvic radiation. Most important symptoms are postmenopausal bleeding. Other symptoms include irregular bleeding and pelvic pain. The disease process, endometrial cancer, often develops from endometrial hyperplasia, which is the thickened uterine lining. The cancer may eventually invade the uterus and fill the uterine cavity. Diagnosis would be an endometrial biopsy and dilation and curettage or DNC. Imaging would be a transvaginal ultrasound would be used, and treatment, it depends on the stage of cancer, extent of spread, and common treatments include surgery, radiation, and chemotherapy. And then there are some more must-knows in the notes. We're going to move on to breast disorders and cancer. So breast carcinoma is a malignant breast tumor and one of the most common cancers in females. An important fact is it is the second leading cause of cancer death in females. Risk factors, the exact cause is unknown, but risk factors include family history, hormonal influences, increasing age, and environmental factors. An important note is that risk increases after menopause. Common findings for most breast cancers, it starts as a breast lump. They grow slowly and are often painless early on. Common location would be the upper outer quadrant of the breast. Signs of advanced breast cancer, so this is something that you guys should know, is nipple retraction, distorted breast shape, enlarged lymph nodes, and skin thickening. Important imaging and clinical clue, peau d'orange or orange peel skin appearance. Image evaluation would be a primary imaging would be a mammography. Additional imaging would include ultrasound, MRI, and a DBT or a 3D mammo. The mammo findings would include breast cancers often appear as dense masses, irregular masses, and stellate or a star-shaped lesion. Cancer may invade surrounding tissues as well. The treatment depends on the size of the tumor, stage of disease, spread of cancer, and may include surgery, radiation, or chemotherapy. And then there are some must-knows in the notes for you guys. An ectopic pregnancy occurs when the embryo implants outside the uterus. The most common location is the fallopian tube, and other possible locations would be the ovary, cervix, and abdominal cavity. Why is this dangerous? As the embryo grows, the fallopian tube stretches and blood vessels may rupture and internal bleeding can occur. An important fact is that ectopic pregnancy is a medical emergency. Symptoms include pelvic or abdominal pain, tenderness, vaginal bleeding, fainting, shock if severe bleeding occurs. Primary imaging would be an ultrasound, especially a transvaginal ultrasound. And then there are some must-knows at the bottom in the notes. We are going to be talking about the male reproductive system. A benign prostatic hyperplasia is a non-cancerous enlargement of the prostate gland. It is very common in older males. Usually it affects men over the age of 50. The cause is unknown, but BPH is linked to aging and hormonal changes. Why does it cause problems? The urethra passes through the prostate gland, and as the prostate enlarges, it compresses the urethra, which blocks urine flow. Symptoms include difficulty starting urination, weak urine stream, difficulty stopping urination, incomplete bladder emptying, and urinary retention. A diagnosis would be a lab test called PSA or prostate-specific antigen. Imaging would include MRI, CT, and an IVU or IVP may show the bladder indentation or filling defect. Common treatment would be a TURP, a transurethral resection of the prostate. It is an endoscope inserted through the urethra and enlarged prostate tissue is removed. And then there are some must-knows at the bottom in the notes. Prostate cancer or adenocarcinoma of the prostate, is a malignant tumor of the prostate gland and one of the most common cancers in males. Important fact, it is the second leading cause of cancer death in American men. The people that are most affected are older males and men over the age of 50. The risk increases, especially after the age of 65. Things that you should know is that the risk factors include age, family history, and genetic factors. Also, it is important that having a father or brother with prostate cancer increases your risk. Diagnosis, there are common screening methods, which would be the PSA blood test, digital rectum exam, or DRE. If those are abnormal, then a transrectal ultrasound, or TRUS, an MRI, and biopsy confirms diagnosis. The common imaging would be the TRUS and MRI. The purpose is to locate the tumor and determine spread and stage. Treatment depends on stage and severity. This may include surgery, radiation therapy, hormone therapy, and active surveillance. Important treatment includes radioactive seed implants, which is brachytherapy. And then there are some must-knows at the bottom of the notes. What is testicular torsion? Testicular torsion occurs when the testicle twists on itself and the blood supply to the testicle is reduced or blocked. This is dangerous because it is a surgical emergency. Without blood flow, the testicle can become ischemic and tissue can die. Important, if blood flow is blocked for more than 6 hours, the testicle may need to be removed. Symptoms include sudden severe scrotal pain, swelling, and tenderness. Primary imaging would be a Doppler ultrasound, which evaluates blood flow to the testicle. If there is no blood flow, that could equal a possible torsion. Nuclear medicine scans may also help evaluate the blood supply and uptake of radionuclide in the testicle. Infection and inflammation would be increased blood flow, and torsion is decreased or absent blood flow. In the middle, there are some must-know notes. What is testicular cancer? It is a malignant tumor of the testicle and is most common in younger males. The common age is between 15 and 34. The exact cause is unknown, but family history may increase risk. Most common signs are enlarged testicle and a hard lump or mass in testicle. It is often painless. Primary imaging would be ultrasound, which helps determine if it is a solid tumor versus a benign condition. Other tests would be a blood test, which is tumor markers. Imaging for staging would be CT, MRI, PET scans, or bone scans. The main treatment would be surgical removal of the testicle. Other treatments may include chemotherapy and radiation therapy. And then there are some extra must-knows at the bottom of the notes. So this is the end of this PowerPoint. I hope you guys have a good week 4, and let me know if you have any questions.